Social enterprises are in our communities and on our high streets, from coffee shops and cinemas to pubs and leisure centres, banks and bus companies.
Your local community nurse is probably employed by a social enterprise too.
Social enterprises are part of the NHS family and are central to the diversity of health and care provision in the UK. Collectively, they have a turnover of £1.5 billion and employ around 100,000 staff. They play a significant role in the delivery of community care, out-of-hours care and a host of other services. These are financially viable organisations. 96% of social enterprises delivering health and care services made a surplus last year, and the vast majority are rated good to outstanding by the Care Quality Commission, the CQC.
We're a community interest company that supports disabled people to live the lifestyle of their choice in the community. We span out of the local authority in 2010, the idea being that all my bosses, all the directors are people with learning disabilities or disabled people generally, who are in charge of a whole range of services that social care used to provide, that we provide in the community for people. So some of what we were motivated by was the fact that if you live in Thurrock, you are likely to die 20 years sooner than your counterpart, nothing to do with your learning disability. So as a social enterprise, we were able to put some of our profit back towards supporting people to go to their annual health checks. Absolutely perfect. And part of helping us to do that was in fact the Department of Health, because at that time they had a social enterprise unit and they really helped us look at our model, think about the way in which we wanted to do it and progress it in the future. Not least of which they gave us a grant. The guys came up with this idea, our experts by experience, the disabled people that we listened to, came up with ideas like a house in transition for people to experience moving back into the community in an efficient way. And one of the guys that came there was a guy who turned up with us and he was having a support package that was probably worth £250,000 a year. And now, 5 years later, he works for us as a coach escort on some of the trips that we do, some of the support services that we provide, and probably has 2 or 3 hours a week of support. Often what's happened to me in the past is commissioners have come to me and said, Neil, we need oranges, oranges, oranges. And I go, hang on, I've been listening to the population and we actually need tangerines. They kind of look the same, but they're a bit different. And I think that's the beauty of social enterprise really, is that we're able to look at those little nuances and understand what the impact and effect that might have on people.
In the early 2000s, working as a director in an NHS organisation, I was disillusioned with the constant change within the system, and yet we saw no patient improvement and staff had no idea who they worked for and no sense of pride in their organisation. Morale was very low within my organisation, so I and colleagues developed a model which brought us together as a social enterprise. I really liked the concept of operating with the drive, the determination and the discipline of a for-profit, but focused on social good. And then we learned about employee ownership, that it was everybody's business and people's voices mattered. And as we brought this in, we heard a change in language from staff saying to me, what are you going to do about something? To what are we going to do about the issue? So we set up in 2006 when 540 staff left the NHS and started their own employee-owned social enterprise in Surrey. But very quickly, we demonstrated improved morale, improved patient satisfaction, more efficient services and much greater innovation.
A mixture of state and independent provision within the NHS is not a new idea. Whilst hospitals and other local health services are often state-owned and controlled, GPs, dentists, opticians and pharmacists have more commonly been self-employed or privately contracted. Independent sector providers have delivered services for the NHS patients for many years, and charities play a critical role in delivering a wide range of health services. In the early 2000s, the government proactively encouraged the development of social enterprises in healthcare. A social enterprise unit was set up in the Department of Health. The Department of Health introduced the right to request policy legislation, which encouraged staff to spin out into newly formed social enterprises, often with a degree of staff or employee membership, ownership or control. In 2011, the right to provide for all NHS staff extended beyond community services on the basis that employee-led social enterprises could deliver high productivity, greater innovation, better care and greater job satisfaction.
We span out of the NHS back in 2011 when we took on the community contract for Mid-Essex. So our mission as an organisation is transforming lives. So what is the benefit of being a social enterprise? Well, I think having worked in both the commercial sector and the charitable sector, I think the social enterprise sector is the perfect mash of both of those sectors into one. So we are a business, need to make a profit, then to reinvest that back into the communities in which we serve. So we have over 1,200 staff here at Provide, and we are a member-owned organisation. And each member of staff pays their pound when they join and actually owns Provide. And what's the benefit of that? Well, they are involved in all of the key decision making. They're involved in developing the strategy for our organisation and also how we invest our profits back into the communities in which we serve.
Accelerate is here to manage our community better, and our community are those with wounds and lymphedema. We spun out of Tower Hamlets PCT back in 2011. And the reason we did this was because there was a waiting list for many patients across East London and beyond. We've really increased the number of patients that we see. We've increased our service provision, and we've also developed a whole education programme and a new online delivery system for dressings. Being a social enterprise gives us the autonomy to make decisions for ourselves as a group. There is a collaborative approach and ownership to the work that we do and Accelerate. So I think the critical benefit of being a small, independent organisation is the voice that you have.
We spun out of the NHS in 2011 as part of the Provider Commissioner split. We provide around 39 different community services across Bromley, Bexley, Greenwich and Lewisham. We have around 1,100 colleagues working within the organisation. The real benefit you get from working within a social enterprise is really much more flexibility. So if you do have ideas about how you can improve care, they can be put in place much quicker than if you're at a more traditional organisation with higher levels of bureaucracy. So we're fleet of foot and can respond very quickly. And one really good example of that was during the pandemic. We had to set up a COVID monitoring service within 2 days, and we were able to let the clinicians lead and transform and evolve that service as the pandemic progressed. Just really supported people in the community. It's been absolutely fantastic to see, and I think that's the whole spirit of social enterprise.
Despite the significant role that social enterprises play within the NHS, they can often be overlooked. And some Department for Health and Social Care and NHS England and NHS Improvement policy decisions can have unintended consequences for social enterprises like us, both nationally and within our local systems.
Social enterprises have an intrinsic value that they bring to the community. They are often looking more broadly at population health, proactively addressing health inequalities. In Salford, Social Adventures is commissioned to deliver public health services, but they diversified to deliver childcare services because that was what the biggest barrier to getting people back into employment was, and they support adults into meaningful work.
Social enterprises are natural collaborators. Many have leadership roles within their ICS or at Place. They have an excellent track record at employee engagement, workforce recruitment and retention, as well as creating additional social value. And as part of the NHS family, they are more than happy to share ideas and approaches with you.